Okay, good afternoon. It's me again, your sister, your nurse, your caregiver, and your daughter. So this afternoon, I want to be creating awareness about cervical cancer. To talk about it now because these are the most common death among women. I feel the best way we can prevent this is via enlightenment and teachings. So I will be introducing us briefly about the cervical cancer. What is cervical cancer? Because this is what we still carry in our bodies, part of the reproductive system. So cervical cancer, as according to study, it is the third most common cancer in the women's worldwide. In women's worldwide, all over the world, cervical cancer is the third most common cancer among women slowly, and begins with a precancerous condition known as dysplasia. It will start early and it will not show a sign that it's actually a cancer, but later on it will now develop from abnormal cells production and it will lead to cancer. But this dysplasia is easily detected in a routine pap smear test, and it can be completely treatable. That is if we detect it earlier. So what are we saying in quotes? Early detection. That is why I need to talk more about it. I need to educate you about it. I need to make you to know what that cancer is. Is it breast cancer? Is it cervical? What is it? You need to know it, detect it early so that it can be cured. So as we move on, I want us to know about cervix. The cervix is just a pathway to the uterus. Uterus is that pouch that the baby is the womb. Okay, uterus in a human body is the womb. If you hear the word woman womb, where the baby is being carried for 9 months. Cancer, it can move to the womb, which is very dangerous. So let's know what is cervical cancer. Now we know what is the cervix. I've just said that the cervix is the neck of the uterus, and the uterus is the womb that the woman carries her baby for 9 months. So we're going to define cervical cancer now. So as I have earlier said, cervical cancer is a malignant tumor. It's derived from the cells of the cervix, which is the lower part or the neck of the womb, the woman reproductive system. So what causes this? What are the causes of this cervical cancer? It is called human papilloma virus, HPV. It is approximately studied that 99% of this cervical cancer are caused by this virus called HPV, which is human papilloma virus. And also sexual history. Yes, a woman has a higher average of this cancer if is active. You have multiple. If she has multiple sexual partners, or for example, a girl is having like 5 boyfriends. Today you have sex with this Mr. A, tomorrow Mr. B, next tomorrow Mr. C. This woman has a very high chance of developing this cervical cancer. And then another one is begin having sex relationships before the age of 18. Like what we are seeing in the community today, a girl of 13 years having a boyfriend, that is too early. Not even up to 15. But right now, study is telling us that a lady who is having sex before the age of 18 is at risk. And then the next one is when you have sex with a man who has access with a woman who is infected with this virus, you are highly risks cervical cancer. For example, you have a husband, the husband is cohabiting, the husband is cheating with you with another woman, Mrs. A, and Mrs. A is having this HPV virus already. That is what I'm trying to explain. But what are the risk factors? Who are at risk? Okay, you don't have a multiple partners. You did not have sex before the age of 18, and then your husband, your boyfriend is not cheating on you. Then are you at risk? Yes, you are at risk. If you are into these categories, or if you are practicing these things I'm going to name now, then you are at risk. You might develop it. Number one is smoking. If you're the type that smokes as a woman, yes, I've seen a woman that smokes. Women, they smoke like men. They even smoke more than men. So they are at risk. Number two is weakened immune system. When your immune system is so low, like the HIV woman, you are at risk. Then several pregnancies. Yes, several pregnancies. When you have one baby, then the baby is 8 months, you already carry another one. Yes, because you have told you that this cervix is the head of the uterus, and uterus is where the baby is. So 8 months, baby is out. On 9 months, this baby is out. Then this baby you just deliver is not up to 1 year. Then you take in again. Another baby is out before 2 years. Then before 3 years, 1 year. Several pregnancies. Then the next one is giving birth at a very young age. Very young age. At the age of 70, you are giving birth. Come on, you are at risk. Then long-term use of contraceptive pill. Contraceptive pills, they are those tablets you take in for you not to be pregnant. When you're taking it too much, when you use them too much, the tablets, you are at risk. And then the last one is family history. Family history, like let's example, your mother has a cervical cancer or died of cervical cancer. You as a daughter, you are at risk. What are the signs and the symptoms? We have the bleeding that occurs between regular menstrual period. For example, you are having period, your period comes at 10th of November, you finish on the 7th, and then you're supposed to see it the following month, December. But in between this November and December, you still see the period. You are at risk. You better go and test yourself. Go and screen yourself. Then when you are bleeding after sexual intercourse, after you just finish sex, the next thing is bleeding. You are at risk. The menstrual period that lasts longer and heavier than before. You're supposed to have a period for 3-4 days. And then you are having it for 14 days. You're having it for 3-4 days. And then you are having it for 14 days. You're having it for 1 month. Go and check yourself. Go and do pap smear. Then bleeding after going through menopause. Menopause is when you have stopped menstruating. As an old woman from 16 years, some early 50, they can stop menstruating. And then after you stop menstruation, you are still bleeding. Go and check yourself. Then increase vaginal discharge. You are the type as a lady, when you sit down, your pant is full with vaginal discharge. Go and check yourself. And then you are having pelvic pains. Go and check yourself. Then how do we diagnose this cervical cancer? It is pap smear. Pap smear test. Pap smear test is a routine cervical abnormalities that are detected early, that detect early cancer. So it is it's just a test. You go to the hospital, the nurse or the doctor will run this test, and then pick the smear. It's just a swab to take from your cervix. While you are lying down, as if you want to deliver. That position, you lie down, open your legs. Then the healthcare practitioner will take the swab with a cotton swab, and then take it to the lab, the microscope. The macroscopic test will detect whether you have this HPV or not. And then we have so many, but as I said today, we are just going to enlighten. We're just going to enlighten you. I'm just going to enlighten you that this thing exists. It exists, but early detection is the cure. It is better we detect it early. It is better you care for yourself. It is better you know who you are, what you are carrying, and know how to care for these organs in the body as a woman, so we can prevent it if we detect it earlier. And how again can you prevent this thing? You have a safe sex. Have one sexual partner, have one boyfriend, have one husband. Don't cohabit, don't cheat. This leads to a very high prognosis of getting this cancer. And then the next one is cervical screening. As I have mentioned earlier, you're supposed to be going for a screening at least a year. A woman is supposed to go for cervical screening to detect any abnormal cells. And then the next one is have few sexual partners. As I have said, have one boyfriend, have one husband. And then delay first sexual intercourse. Yes, don't say because I am a woman or because my parents forced me to marry at the age of 18 I need to have sex. Yes, if you do that, you are at risk of developing this disease, cancerous disease. And then the next one is smoking. As a lady, even as a man, smoking is bad to the health. Why will a woman go into smoking? So we're telling you now that the cells smoking also can contribute. What I'm trying to say in essence is that prevention is better than cure, and early detection need a high increase of cure. So in our next, by the grace of God, as we move on, this is just an awareness. We'll talk more about it, discuss more about it. We'll discuss more about the tests, and then more rooms for questions. Please, if you have any question, please drop it in my comments. I will go through it and I'll answer the questions accordingly. Or if you want to ask question, or you want to ask more about it, you want to talk to me particularly, please feel free to request for my number. And please feel free to join my Facebook page, FLK Health Pro. I put a lot of health talks there, how to monitor your health, how to care for yourself as a woman, as a man, how to monitor your BP, because blood pressure is also an high rate of death right now. You just see a woman will fall down. That is the end. It is not the end. It is not supposed to be the end, but we did not detect this early. So thank you. I'm waiting for your comments. Bye.